Hi everybody, welcome back to my YouTube channel. My name's Ashley Agan. I'm a board certified ear, nose, and throat surgeon. And today I wanted to talk a little bit about breastfeeding, breast milk, and ear infections. Now, if you're a parent with a child who is having ear infection after ear infection, sleepless nights, multiple rounds of antibiotics, you're looking for a solution. What could I be doing to potentially help decrease the number of ear infections? And so today I wanted to talk specifically about breastfeeding and breast milk versus formula and how that might relate to your child's recurrent ear infections. Now, there have been numerous studies that support that breastfeeding is protective against recurrent ear infections, and that's in a dose-response fashion. When it comes to breastfeeding, as much as you can is helpful, so it's not an all or nothing thing. So for example, when my little one was a baby, we started out with the intent to exclusively breastfeed, but then there were challenges, and ultimately we did, in the end, it was probably about half and half for those first 6 months. And then we started introducing solid foods, and she would have a little bit of breast milk, but a little bit of formula. And so you do the best you can, right? So all that to say, breast milk is protective. It is likely protective because it has immune protecting factors within the milk itself, right? There's antibodies from the mom that get transferred into the milk that are going to be protective for the baby. In addition, there are some hypotheses that when a child is breastfeeding, that the way the tongue and palate are moving, that action in itself compared to bottle feeding is better. And so there's two pieces to it. There's the breast milk itself, and then there's the act of breastfeeding. And as a mom, I recognize that it's easy to say, just breastfeed your kids. But for some people, that can be really challenging. And so you do the best you can. If you're not able to breastfeed, but you're able to pump and give breast milk in a bottle, that's great. Do that. If you don't have a milk supply and you need to supplement with formula, do that, because ultimately your child needs calories and nutrition. And if you're able to provide that with breast milk and with breastfeeding, then that's great. But if not, then there's other things we can do from an environmental standpoint and lifestyle standpoint that can help your baby decrease their risk of infection. Let me know if this makes sense. Comment below. Let me know what questions you have.